Let's look at two pre-built dashboards, specifically for payers to see risk opportunities within their networks. The first is the Risk Navigator dashboard, which you can see right here. This is the homepage for all things risk within Arcadia. This is meant for your analyst teams or your program teams to come in and start to get a high-level sense of how your organization is performing across your different lines of business through different types of risk, and then drill those insights down into the PCP or condition level, or patient level for your population. On the Summary tab, here you could see high-level questions. How are you doing across the years by line of business? And then we'll always break down a risk by closed RAF over here on the left. And open RAF will further be broken down into historical and suspected. Historical risks are those persistent risks that are seen throughout time for your population. Suspected risks is anything that Arcadia suspects in our proprietary suspending engine once we run all of your data through our system. You can further refine these lists to look at specific levels of your provider hierarchy, such as regions, or all the way down to the specific primary care doctor. This will let you get a sense, including some light modeling here, around what number of PCPs are really driving those open risk gaps and how you can start to affect those. Once you've picked a PCP on the prior tab, you can come to the Scorecard tab, and for your provider engagement team or provider outreach team, you can start to look at the specific PCPs and present them with a high-level summary of what their program looks like this year, what is their open and closed risk and percentages by member, as well as what those total open conditions look like here on the bottom. All of Arcadia's data is run through our episode and claims grouper, which then further breaks down risk into specific condition categories. You can see all your categories over here on the left, again, broken down by open and close, as well as a more detailed summary here on the right. And if you want to drill any further to, let's say, lung conditions, you click on the category in the left, and it'll further show you different information on the right, such as total pitch, patient population, the risk value members gap, gap closed, potential appointments, etc. You can take this all the way down to the actual patient level through the dashboards as well as many of our other tools throughout Arcadia. A second dashboard specific to risk is our retrospective risk opportunity dashboard. This is a wonderful workflow tool for you to look at the current open gaps that you should have received a claim for, but have not yet seen one come across for this specific time period. So for example, if I'm going to open this table in the center here, but if you know that you've got your last month's claim thrown out, you have a claim slack of 90 days. You can set those filters across the top here to set those date ranges. And then you would see a detailed list of all the conditions that were coded from a clinical source but have not yet been actually documented on the claim. This gives you the exact patient, the day of the event, as well as all of the provider information, so that your outreach teams are able to begin to find those patients accordingly. If you have any additional questions or want to see more about how Arcadia can work with your organization to fill risk gaps, please reach out to our team through our website.